Welcome back to Blood and Guts, a surgical expert breakdown podcast. We are here today with a very special, intelligent, intriguing guest that you are going to really like if you don't know her. And I only recently met her, but this is Dr. Gretchen Green. She is a board certified radiologist, entrepreneur, business person, seasoned expert witness, and we're very happy to have you today, Dr. Green.
Thanks so much for having me.
So let's start by who you are, what you do, and how can you help the listeners that are interested in becoming a surgical or an expert witness in the medical legal arena?
Absolutely. So, as you said, I'm a radiologist. My whole career was in private practice in North Carolina. And soon after beginning my practice, I was sued. And so that's how I was first introduced to the medical legal arena, was in my
Right.
own lawsuit, which we subsequently resolved after a few years. And that path, learning and seeing how expert witnesses were involved in the case, that really gave me my first exposure, being thrown into the deep end of the pool. And
Right.
my, defense attorney said, "Hey, when this is all over and said and done, you should become an expert witness." And of course, I thought, well, that's a crazy thought. I never want to do anything like this ever again.
Right.
And then,
Right.
like many of us, a few years went by and I got a call out of the blue. And so I kind of became an accidental expert witness, knowing nothing of what I was doing. The medicine was the easy part, even though
Right.
it was a complicated obstetrical ultrasound case. But I learned that I just loved working with law firms. I loved putting my skills to use in a new way. It really energized my career and helped me be a better doctor.
Yeah.
And so I learned everything I could, trial and error. And now
Right.
I teach other physicians and clinicians, including non-physicians as well, because we have lots of opportunities for expert
Right.
witnesses now,
Right.
how to launch and build their own expert witness practices, but without doing it the hard way like I did.
Right. So let me ask you about your first case. What was the thing that irritated you most about the expert witness that said you fell below the standard of care?
In that case, my challenge of being an expert was not the medical part of it. It was the simple questions that I just didn't know any answers to because no one had ever taught me. Like, what is your fee schedule? I was like a deer in headlights when the law firm asked me that question,
Right.
and I thought they were referring to my calendar or something.
Right.
And then I
Right.
learned again, and I fortunately, I took a lot of courses. I read all the books I could. I had a great mentor. And then I learned how to do the nuts and bolts. And that helped me really enjoy the work a lot more in all the aspects, is just, again, taking care of those logistics to do the business and to know how to do the medicine as well.
Well, I was actually asking about the time that you were sued, because obviously, because I've been sued 5 times, two were dropped, 3 were settled, but you get an emotional response, right? Because all of a sudden you feel like you are the worst doctor ever. You have no idea what you're doing because somebody that's board certified like you, that's trained like you, is looking at you and saying you fell below the standard of care. So well, one of the reasons I ask about that is, those of us that testify on behalf of a patient and talk to plaintiff attorneys can make a lot of enemies doing that. And I get asked by my own colleagues, how dare you talk to a plaintiff attorney? So how do you handle that?
Yes, and I'm so glad that you brought this angle up, because that's the way that we think about it matters. So if, as an expert witness, you think about it that you're against one side or for another, then that's going to really hinder how you interpret the medicine involved and could
Right.
introduce bias. And so one of the things I really work with my students from the beginning is framing this in a neutral way, that you are there to be the expert in medicine. You're not there to advocate for one side or the other. You're there to be objective and to
Right.
use your skills, training, and expertise to render an opinion in the case. And I've listened to your previous podcasts and totally agree with that. A lot of the time, you're retained by the plaintiff or the defense, and yet you may not have an opinion that aligns with what you would consider to be their side.
Right.
And what I've learned
A
over
lot.
time, yeah, a lot.
Yeah.
And And it's different for each case. And so that's why it's so important for experts to be retained by both sides, is so that they're not choosing cases from the beginning based on what they think they will hear or want to say. And, I love thinking about like what if this were just totally normal? What if expert witness work was expected from physicians, that we did this service in the legal community, just like our peers do and we do if we're called for jury duty? Like,
Right,
why would we think our peers would be qualified even more to be the jurors of these complicated cases, not only in medicine, but for all the reasons that cases come to courts,
right,
if we don't trust ourselves to use our very high level of those skills, training, and expertise. And so that's something I do to help people get confidence in doing it, that you're
right,
abundantly trained in all of these things. And
right,
it's a dynamic process. And
right,
that's one of the best things, is you can be such a resource to your practice, to your colleagues, and ultimately to your patients doing expert witness work, because of that level of intellectual ability that you bring to it, and that commitment to communication and education, which is what we do every day when talking with patients and families.
right. Now, and as you know, because you were in the private sector like I was for a long time, we do tend to monitor ourselves, and a lot of patients or lay people don't know that with the peer review process. And you've probably been on the peer review committees, which is, protected by law for lawyers to get access to what we talk about, but we do that. And I've been on every hospital I was at was on the peer review committee, and I thought it was great. I think it's one of the best committees because you have a sense of what's going on in the hospital, and you can there are system changes that you can make to improve patient care and patient outcomes. So no, I mean, but you're right. When you were saying that, I was thinking of peer review, which is really what we do, which is similar, although a little bit different.
Exactly. And I think that's when we see there can be differences in opinion. And that's why experts will sometimes take different viewpoints and different sides of a case. So we're
Right,
not always going to agree, but you have to have a good reason why not.
right,
And so there are legal standards, of course, that vary from state to state as to why you can support your opinion. And so that's that process of knowing the literature, consensus papers, your professional society statements, and using those things as well as your expertise to help inform that. But I think the process of neutralizing is that word that I kind of keep coming to in my mind, is so important, and it crosses over to so many other areas of your life, that you will have experts in your case where you just won't agree. And so going
right,
back, and I think if I understand your question, it was, what was it like, being sued and knowing that there was an expert who said, I did it wrong. That's okay if
right,
you don't agree. And as it turned out in my case, it was a very rare case, of course,
right. Of
of,
course, yeah.
a young woman in her early 20s who felt a lump in her breast. She came in for an ultrasound, which was a follow-up. I recommended a biopsy, but she said no because she was afraid of needles.
Okay, that happens.
I, being relatively junior and knowing that patients read their medical records and things, was trying to avoid being judgmental or negative. Therefore, I gave all the factual information in the report, but I didn't put the part in about her saying no because she was afraid of needles,
Oh,
even though now I appreciate that that's part of the art of medicine, is documenting that in a way that simply represents the patient's point of view and isn't,
right,
throwing them under the bus or
right,
judgmental, just indicates where their barrier to that was.
right,
And ultimately, she subsequently came back for delayed follow-up. It
right.
turned out to be cancer and
Of course,
metastasized. Unfortunately, she passed away.
right. Yeah,
But that was how that interaction went. And so that
right,
was, again, a learning opportunity. So, but for me, it really came down to the medicine of it. And I learned to deal with that. It was emotional. It was very difficult. And so I'm always
yes,
mindful of that process.
right.
And so that's something also now that I take into account when I'm coaching and training experts to do this, is to really deal with some of those emotions and keep it as much as you can about the skills and the medicine.
Right, and then the point is, and when I'm dealing with that too, it's not up to us what the jury decides, right? Right, I don't, and it's a very difficult process for the jury. You have two well-trained, board certified, highly educated, big CVs, nice, beautiful white coat, right? Saying exactly the opposite. how in the world do we fight amongst ourselves about different things. Can you imagine if you have very little to zero medical background and trying to make a decision of who's right or who's wrong? I mean, I joke all the time that the truth doesn't matter in the court of law. It's, do they like the expert? Do they believe the expert? Who puts on a better show from the plaintiff attorneys? Because it's their world, it's not our world. And you, as me, feel much more comfortable in a hospital than we do in a courtroom for obvious reasons, because this is where we are all the time. So, but yeah, that's interesting. Tell me about how you started in terms of teaching others, because through the years, I've had people come to me, the residents, my other colleagues, listening to what I do. Why are you doing that? Some say I'm an idiot, to talk to plaintiff attorneys. How did you get into that in order to do the business that you're in?
Right. I had been an expert since about 2016, reviewing cases, building my business, learning about marketing, and forging my own path. 2020 rolled along, and
Here we
about
are.
March of
Yeah.
2020, I
Yeah.
started getting phone calls from
Yeah.
attorneys. At that point, I had thousands of lawyers in my database because I had built this network nationwide.
Right.
And they started asking me, hey, since we can't go to court, we can't do anything in these cases, we're sitting on our hands, but we have cases that need reviews. Do you know experts who could review these cases? And but we are kind of afraid to ask, honestly, because we think you're all out there saving the world from COVID. And it was like, well, actually,
Yeah.
as we, 2/3 of physicians who were
Right.
furloughed or fired during COVID, right? The Black
Right.
Swan event, no one saw coming in that kind of event.
Right.
Doctors found themselves with real financial needs and real needs to keep their skills up and to realize, oh, maybe I do need to have ownership. I need, especially as more are employed than ever now in medicine,
Right.
I need to have
Right.
ownership. I need to market my own skills in a different way and be able to make some money that can support myself and be able to go back and keep my practice alive.
Right.
So that was the perfect storm. And so I decided to do something about that need. I started to connect physicians with attorneys. And then, of course, a lot of the physicians said, sure, I'd love to do that, but how do I do it? And
Yeah.
so in a couple weeks over the summer, I put together an online course, and that is Expert Witness Startup School. I put it under an umbrella name for the business called the Expert Resource, with the idea being it was going to grow into something much more multidisciplinary, which it
Right.
has. And so now I've taught hundreds of students how to launch and build expert witness practices. I've expanded into a medical case review mini course, which if you want to get started and you want to review cases for your medical board in your state,
Wow.
quick and easy way in under 2 hours to get started with that. It also
Good.
complements the medical legal field in terms of some litigation.
Perfect.
So, and now we have a comprehensive marketing platform that helps experts get their name out to my 15,000 plus lawyer database now and helps everybody in a win-win connection and networking
Right.
situation.
That's great. And for the listeners, I'm gonna link all that to the show notes. So you'll see all this. I'll link all the websites, how to get a hold of Dr. Green, and that'll be real helpful. Let me ask you, is there any cases that stand out that are memorable that you learned along the way that you shouldn't have done and you might have helped hurt in terms of what happened? Meaning, and the reason why I say that, again, not advocating for one side, but I learned early on that, to me, what you say in deposition, it is really important. And if you don't really know the case well, and I look at it that I have to know everything about that case better than the attorney asking me questions, because if I don't know it, they could spin it the way to get me to answer the way they want. And I remember having them put me in a box saying at the end of the deposition, Dr. Cohen, do you have any other opinions that you intend to offer at trial? No, I said everything, right? Of course, something changed. And I wasn't allowed to bring up the smoking gun, which we only found out later, and that was a problem. So is there any moments like that, kind of big things that stick out? Because that one I'll never forget.
Right. It takes one painful experience like
Right.
that to really get it in your memory. And for those who wonder, well, why was that not the right answer? If you truly didn't have any other opinions, the answer is, the stock answer you'd give is not at this time. However, if I were
Right.
to be provided with additional information, that could change my opinion, and I reserve the right to review any additional information that may be given to me.
Right.
So for those of who
Exactly.
wondered, where'd you go wrong? Because it's not obvious. And
Okay.
that's why we learn, and that's why we teach each other. And that's why I offer this kind of program, is so that people do know the answer to that. I don't remember there being any, gross missteps in cases. And partly because, and I don't judge them by the outcome. I don't judge my own
Right.
performance by the outcome of the case.
Right. That's
That's
important.
yeah, and that's another way I think that experts can go astray, is by thinking and I get this all the time. People will say, I think I lost the case for them.
Yeah.
So that's
Right.
impossible.
Yeah.
These are very multidisciplinary cases. There's a lot of people. They don't often go to trial.
Right.
And so, for those who wonder, 99% of this work is done on your own time, usually at home, totally flexible. Be 1 to 3 cases out of 100 that might go to trial. Those you can also kind of work with your schedule and things with your contract to make sure that you can be there and still uphold your responsibility to your job. Because the
Right.
lawyers need you to be employed as a doctor too. That's generally the qualification. So
Correct.
it's a two-way street.
Right.
There have been plenty of times where I've said, I think this is an uphill battle. Like, I think this will be a difficult issue for the jury. Here's how, and here's where having that both sides expertise really benefits everybody. Is I'll say, here's my opinion and bullet point support, so forth. Here's what I think the other side could think.
Right.
And here's why. So if I were the other side, here's what I might imagine that they could be thinking and what they could counter.
Right.
And so it's not my fault if things like that happen later, or, hey, they may come up with, that's the fascinating part, is people come up with theories that you never in a million years would have thought of, that seem very creative. And so if that happens, it's not your
Right.
fault. It's a thought process. So
Well, the other thing is, you've heard attorneys say that if they can win on a technicality, they will win on a technicality. Sometimes your opinion, if you're really good, which you are, and I've had attorneys say you're good, they want to exclude, they don't want me to say that to the jury. So they will try to exclude my opinion that loses the case for them. Again, they're trying to win on a technicality. We have no control over that. I just know the medicine. I don't know the law, right? So yeah, that's interesting.
yeah, this is a complicated chess game, and it evolves over the length of a case, which can last months to years in some of them. And we are one part, but I think as long as we just remember that our role is education and communication.
Right.
I also
Right.
think there's a bigger role here, which is representing the medical field. And I think that especially now we have a great opportunity in expert witness work to truly portray, to be a source of knowledge for people and to be authorities in a world where it's easier to turn to Dr. Google and
Right.
a lot of different sources that may be competing on the internet. For us to remain authorities, I think, is another reason why this work remains so valuable. And it's not so much, we talked a little about like trial. It's not showmanship when you go in with the true intent of communicating with the jury in the way that you can. I was on trial recently in a case in the Midwest, and they actually have a really interesting option that the judge can offer the opportunity to the jury to ask the expert questions.
I've had that. I thought that was great. I was like, "Oh, do you have any questions, Dr. Cohen?" Really? Okay, that's great. Yeah, that's great. Yeah,
I that
amazing.
was It was wonderful because I truly felt, and the case it was not found substantially in favor of the plaintiff, which was the side who had retained me. So,
Right.
like, again, you could have said, well, did it work? Quote unquote, did it work? Well,
Well,
no, they didn't get a big verdict, against the defense, and the defendant presented very well on the stand. But I saw when I was answering the questions of the jurors how much they connected, how much they appreciated that. And so whatever we can do to maintain that relationship with the public, to remain authorities, to remain trustworthy, and to do
Right.
our best job is
Right.
valuable.
Well, yeah, absolutely. I've had a jury fall asleep while I was talking. I mean, you got to be kidding. I mean, seriously, I'm off the stand, I'm drawing pictures, and I'm looking, he's like, he's falling asleep. Okay, that's helpful. Right. But the way I look at it too, and this is what I tell attorneys, the only way this process works is you have to have qualified physicians explaining to the jury, to the judge, to the court, what is standard, what we do and why we do it, right? I mean, it can't work any other way. That's the way the system is. So you have to have people willing to talk to attorneys to explain to the jury what we do. Were you ever involved in teaching in your private practice? Did you have medical students or residents?
We did in different institutions where I worked, no radiology residents, but I had other residencies who would rotate through. I
Right,
also gave talks at CME conferences,
right,
and during and after fellowship, I co-authored 2 breast imaging textbooks. So I've always still had my fingers in the pie
right,
with teaching, but not in a full-time academic role. And so for people who think, hey, I can't be an expert because I'm not in academics.
right,
I'm not a professor. Well, neither
right,
was I. I did hold a community appointment at a
right,
medical school, but no, I was not a academic track professor with those credentials. But that's what most of us are. Most of us
correct,
are community private practice
correct.
in the
It's
trenches
your
doing all that work.
it's your education, it's your experience, it's your training. And I will tell you, and my mentors aren't listening to me, which probably, or maybe they are, hopefully not. But it's the ones that publish a lot that are in academics aren't in the trenches as much as all of us, right? So that's the other thing. You don't have to have all those credentials to be able to opine on what is standard of care because you've done it hundreds of times or thousands of times, right? So yeah, that definitely makes a difference. But the point about the teaching is you've had a lot of residents, if I can't explain it to the residents, then I don't know it myself, right? I need to explain, and that's like the jury. I mean, the residents know more than the jury, but if I can't explain it to them, right? So I think that makes a big difference. Um, but again, all of us, even in private practice, the nurse may question you, why are you doing this? Why do you need the Foley? Why? I need to explain it to them. Why do you need this kind of contrast? Because that's what we do, because I'm looking for 1, 2, 3. Okay, right. So we're kind of all in the teaching mode anyway, because of what we do and the nature of the business that we do, for sure.
It surprised me when I transitioned from the first practice I worked with to the next. The staff, when I left, my techs with whom I worked hand in hand every day. I mean, mammography techs, other
Right,
ultrasound techs, they were like my right and left hands, with the patients.
right,
All of them said it when I left, thank you, Dr. Green, you've taught me so much. And I thought,
right.
how did that happen? I mean, I'm here doing the job. I didn't, and it was unconscious, I think, because that's our role, like you said. So we have to, I think, be more conscious of the fact that that is our job. We are always teaching.
Right. If what does the future hold for Dr. Green? What do you see the next 5 to 10 years in terms of medicine? What do you see some of the changes coming? What's your opinion about AI and radiology? Because things are going to change.
Yes. I actually participated in several clinical trials for AI's use in breast imaging, both for
Wow.
mammography as a reader tool and in ultrasound. That was fascinating to
Yeah.
participate and get hands-on, to work with that new technology and see it evolve over years as they developed it.
Right.
So I don't think it's going to replace humans any more than AI will replace any of us at the bedside. And for
Right.
me, for radiology, being breast imaging and women's imaging is predominantly bedside with patients. So
Right.
contrary to the usual stigma of us, being in the dark closet room by ourselves.
I do make fun of you guys a little bit, like how to hide a $10 bill from a radiologist is attach it to the patient. I apologize. I'm sure you got ones for surgeons. I apologize. Okay.
Oh, I love working with everyone. And so for me personally, I did retire from clinical practice almost a year ago now that we're in 2025. And so that's been much more of a transition towards teaching and running my courses full time.
Right.
And so for me personally, I'll continue to run Expert Witness Startup School, continue to expand this platform for networking, for connecting experts with lawyers and vice versa.
Great.
And in my free time, I've always liked doing lots of different things. So I just finished a term as the chair of the board of the Space Camp Alumni Association.
Wow.
And now I am on the U.S. Space and Rocket Center Foundation board also in Huntsville, Alabama. So I will be continuing on and doing that role to help what I hope will be training the next future generation of astronauts to explore our world and beyond.
Awesome. Yeah, that's great. Well, we really appreciate you being with us. I'm gonna link how everybody can get to you to this, and I'll be posting that. But appreciate you being on, and thank you so much.
Yes, thank you so much.